Hey, Pete.
Hi, Joan.
I know that when you started your lecturing and in your first textbook and subsequent textbooks, you used the phrase, the concept of complete dentistry. Can you tell us what complete dentistry means?
I sure can. Maybe the better discussion would be what is incomplete dentistry, because it helps understand better what it's about. And it's not complete dentistry if a patient walks out of your dental practice as a patient and still has oral disease or problems that would lead to worse problems if not treated in a timely way. Complete dentistry is based on a concept that our job is, as physicians, of the total masticatory system.
Mm-hmm.
We're responsible for all the structures in the masticatory system, and we are responsible for helping our patients get them healthy if they are not healthy, and then keep them healthy.
Mm-hmm.
That means we have to end up with stable temporomandibular joints.
Mm-hmm.
We have to have stable supporting tissues, and certainly cleanable teeth and gums, and beautiful smile, if that's what the patient wants,
Mm-hmm.
and teeth that are maintainably healthy. We can't be a complete dentist if we just look at teeth.
Okay.
Because the temporomandibular joints determine how the jaws come together.
Mm-hmm.
And how the jaws come together in function and dysfunction determines whether or not those teeth hold up. Whether we have occlusal disease, which is signs of instability, such
Mm-hmm.
as excessive wear, mobility, loose teeth, and movement of teeth out of their original position. So our job as a complete dentist is to see signs rather than waiting for our patients to tell us their symptoms. Because signs precede symptoms.
Okay.
Symptoms show up after signs have been there. Patients don't tell us about signs.
Mm-hmm. What would you mean by signs? What might those
A sign is something really that we have to see that maybe the patient isn't aware of. A symptom is what they feel.
Okay.
So decay can penetrate all the way to the gum line, all the way to the pulp, before the patient might be aware of it.
Mm-hmm.
So we would pick up decay before the patient is aware they have it. That's why we take radiographs.
Mm-hmm.
We have to probe for periodontal pockets.
Mm-hmm.
The patient doesn't come in and tell us that they have pus under their gum. We have to find it. And we have to be responsible for pointing out when they have problems of wear. The early signs of wear are indications that the occlusion is not in harmony with the joints and with the way the jaw moves. So the complete dentist is going to look for signs that will require treatment before they become more problematical.
Okay.
Every problem that we see in dentistry almost is progressive.
Mm-hmm.
Wear gets worse, TMJ problems get worse, periodontal disease gets worse, decay gets worse. So the complete dentist could never be called a complete dentist with a 15-minute exam that ignores looking at all of these issues.
Right, so that's another phrase that you use, is a complete examination, not a comprehensive examination, but a complete examination. So
I like the word complete.
And that would mean that it examines all the things you were just talking about then.
Right, and if we understand how the masticatory system works, which has always been our mantra here, that you must be a physician of the masticatory system. If you understand how it works, then it becomes apparent when you see a sign, such as wear,
Mm-hmm.
that is simply an indication that there's disharmony in the system. And then it's up to us to recreate the harmony in the system so it can be maintainable. Mm-hmm. Teeth are made to last a long lifetime.
Mm-hmm.
And the idea that, well, you're just getting older, therefore your teeth are wearing out, is not right. You can live a very long lifetime and still have all your teeth and have them in very good functional condition.
Mm-hmm.
And so that's why we look for not only the problems, but we look for what causes the problem. And for the patient standpoint, we look for, well, what are the implications of not treating each specific problem that we see if it's not treated in a timely fashion. And that's really what we mean by complete dentistry. And you know, it's what it is honest treatment of patients. And it's good for the patients, and it's extremely good for the dentist and the practice.
What would be some differences in a practice that really is practicing all the principles that you teach of complete dentistry versus one that is more incomplete? What are some of the differences in a practice that you can think of?
Oh, well, there are many. And one of them is if you understand the causes and effects of problems in the mastoid system, you're able to go ahead, diagnose, treatment plan, and get the job done with an extremely high level of predictability. There's almost nothing that we have to guess at today, including the exact location of incisal edges or inclinations of anterior teeth. We don't have to guess where anterior teeth go. We have methods of determining right down to the fraction of a millimeter where every part of that tooth goes and what contour it should be. And we don't have to guess at what's wrong when somebody is complaining about pain in the TMJ region, because nothing can hide from us anymore. We can know exactly what's going on in that joint, and we can, and far more than 90% of so-called TMJ problems are treatable by a general dentist if they just understand the cause-effect relationships that are going there. The problem that I see in confusion in dentistry about occlusion and temporomandibular joint disorders and orofacial pain, all those things, the problem is not that it's so complicated, it's that there's so much misinformation about these things. And once a dentist understands the realities of cause-effect relationships in the system and how to fix them, dentistry becomes a wonderful, fun way to make a living, because it's like a hobby. It's like a mystery. Every patient that comes in, we're trying to figure out, how do we solve this problem? How do we solve that problem? And of course, we have methods for doing it. So there isn't any guesswork at all involved in dentistry today.
That's exciting. It sounds like one of the primary distinctions that you're making is that idea of cause and effect, and that not just treating an effect until you understand what caused it. Is that a big part of complete dentistry?
Big part of complete dentistry. Treat causes.
Causes.
And incidentally, you know, if we understand how the system works, and just such things as what we call the functional matrix for anterior teeth, we can absolutely get the very best natural aesthetics as possible, because we make the teeth fit the functional harmony of the patient. And if you have functional harmony, you'll have to have anatomic harmony to achieve it, and anatomic harmony is your most beautiful aesthetics that you can have. And again, as I say, there's no guesswork about how to get it.
So what would be the most important thing for a dentist to learn beyond the basics that they learn in dental school to be able to embrace complete dentistry?
Well, of course, where we start with is the jaw-to-jaw relationships. We find not enough dentists understand centric relation. Centric relation is related to the proper physiologic, anatomic positioning of the temporomandibular joints when the teeth come together, maximal intercuspation. And you want to have perfect harmony between maximal intercuspation and the completely seated joint position, which is what we call a centric relation. And since most dentists really don't understand this, it changes their life when they do understand it, because that keeps you from having the predictability. If you don't understand centric relation, that's your starting point. Because until you get centric relation right, you can't get the anterior teeth right. You can't get the posterior teeth right. You can't diagnose orofacial pain properly unless you understand the role the temporomandibular joints play in how the jaw closes and how function occurs to and from centric relation.
Well, there's certainly thousands of dentists that I've met in the 20 years that we've been working together that talk about not just how you change their practice, but you change their lives. So thanks for taking some time today to tell us about complete dentistry. And We'll continue to help dentists understand that every chance we get.
Well, it's always a pleasure, Joan, and it's my passion to see that dentists do understand it, because it does change their life.
Mm-hmm.